The reason we're combining mosunetuzumab and polatuzumab really based on the different mechanisms of action. The mosunetuzumab is a bispecific antibody which recruits the CD3 positive T cells to lymphoma cell with CD20 expressed on the surface. Polatuzumab is an antibody drug conjugate. So the function of polatuzumab does not depend on recruiting T cells. What it does is recognize a different antigen on the surface of lymphoma cells, CD79B. And this antibody is tagged with a chemotherapy-based payload. So it's like a smart chemo targeted to CD79B expressed on lymphoma cells. And by combining these two, we attack the lymphoma cells from two different angles, which made the lymphoma cells less likely to evolve and build up resistance. And another important reason that we combine these two drugs is also based on the non-overlapping toxicities. The mosunetuzumab is a pure immunotherapy, so its treatment-related toxicities from what we learned from monotherapy using mosunetuzumab is more immune-related side effects, such as low grades of second release syndromes, and it doesn't really affect the blood counts much, and it does not have the peripheral neuropathy that polatuzumab has. And on the other hand, polatuzumab as an antibody drug conjugate, it doesn't really cause second release syndrome, and in fact, it might help to debulk the lymphoma bulk and might have a chance to further reduce the second release syndrome that's seen associated with monotherapy of using mosunetuzumab. The question to explore is to test out this regimen combining polatuzumab and mosunetuzumab in similar patient population, but we want to treat more patients to be more confident with the efficacy and also with the side effect profile. So far we have seen very encouraging efficacies and very well manageable side effect profile. So with treating more patients, we will be more confident. On the other hand, we also would like to bring these regimens to other disease settings, aggressive B-cell lymphoma, diseases that also express CD20 and CD79B, to really test out these combination regimens in other disease settings, which we're hoping also to see good efficacies and bring these therapeutics to those patients.